Good morning, Borodar, and welcome, Croiser, to our webinar on shared lives and mental health crisis, which we hope will be informative, engaging and inspiring. We have lots of speakers to give you multiple perspectives on the work, and there will be a chance to ask questions at the end. So please use the chat function or the Q&A function. You'll see those buttons at the bottom of your screen to post your questions, and we'll pick those up at the end. My name is Benna Waits. I'm Joint Head of Psychology, Counselling and Arts Therapies for Aneurin Bevan University Health Board, and I'll be chairing and presenting this morning. It now gives me great pleasure to introduce Alex Fox, who is the Chief Executive of Shared Lives Plus. He also chairs work on behalf of NHS England and is an Honorary Senior Research Fellow at Birmingham University. He was awarded an OBE for services to social care in 2017. And he's also author of this book, A New Health and Care System, Escaping the Invisible Asylum. I can recommend that very highly. I think it's a fantastic book. So Alex, over to you.
So I'd just like to welcome everybody to the event and say how pleased and honoured we are that the work of our members in South East Wales on crisis mental health support has been recognised by the World Health Organization. And the South East Wales Shared Lives programme is one of 150 right across the UK. The UK is something of a leader in shared lives globally, and actually Wales within the UK is the leader in terms of the numbers per population who are supported in shared lives. So there's some real success here, although we are also very ambitious. We want shared life support to be available to many more people with mental health problems as well as other support needs. At Shared Lives Plus, we're the membership body for both the Shared Lives services in the UK and also 6,000 of the 10,000 shared life carers in the UK as well, the individuals who open up their homes and share their lives with somebody who needs significant support. And to give you a sense of the shared lives model, probably the best thing I can do before you listen to Nikita and her story later on is to tell you a little bit about something that my colleague Meg, who used Shared Lives, still uses Shared Lives, said, which always stuck with me. And she was talking about when she lived for several years on hospital wards within the mental health system. And she said the people that looked after her on the hospital ward did care. But when they go home at night, when their shift ends, they had to switch her off and go back to their own lives. And she contrasted this with moving in with her shared life carer, Hayley, where she moved in and became part of Hayley's household and had that level of care, which wasn't switched off at night, which was there whenever she needed it. And she still has a really close relationship with Hayley now. And that's true of many people that use shared lives and their shared life carers. So it's a model which brings together two worlds which we often keep separate, particularly within the mental health system. We have the world of the personal and the private, what people do in their own lives and communities. And then we have the world of the professional, of the service and the medical world, people being treated for their illness. And Shared Lives tries to bring those two worlds together. So shared life carers in the UK are they're trained, they're paid for what they do, they're part of a regulated care service that the government inspects. And there is infrastructure and support and structure around that model. But then they are also people that after they've gone through this really extended approval process, which ensures that they're the right person for the role, then shared life carers and the individuals go through a matching process. They get to know each other, they decide whether they're going to be a fit, and that enables them to live in a way that doesn't feel like it's part of a service, to live in a way which feels much more human, in which people who come into, if you go and visit a Shared Lives household, it feels like visiting anybody else's household. It feels like ordinary life. And it's that combination of the professional with the personal, which gives the Shared Lives model its power and which makes it so unusual as well, and sometimes tricky, because so much of our regulation and our laws and how we organise things are designed around a separation between the personal and the professional, the community and the state. Shared Lives is a model which is now available right across the UK. It reaches 15,000 people. About 1,000 of them are primarily using it as a mental health service. We'd like that number to be much greater, because obviously that's still, although it's substantial, it's still a tiny fraction of the number of people who use mental health support in total. And we also want many more services to learn from the Shared Lives model as well, and what we'd like other services to think about when they see Shared Lives working is not just how many more people could benefit from this model, but also how is it different? And it's different in a number of key ways. Through recruiting people, sometimes over a number of months, certainly over a number of weeks, getting to know people really well, and then through the matching process. Shared Lives is able to set up support arrangements which feel much deeper, which feel much more human, which are much more aligned with people's lives, and in which people are supported by somebody who's going to be there for the long haul. Whereas too many of our services throw a succession of strangers at people going through these very long, complex public service journeys. So we want all services to think, how could we get people involved that we knew well enough that we would be able to put them in much deeper, much more longer lasting support roles, and with a view to people actually being able to not just get the support they need, not just be able to meet their medical outcomes, but actually to be able to think about, what does a good life look like to me, and how can we together go about living it. South East Wales and this service is one example of how you can do that, and we want there to be many more right across the UK.
Thank you, Alex. What an inspiring beginning to our morning. I think you really highlight why this matters and the power of this way of working to transform lives.